to consider. The gentleman from Oregon is recognized for as much time as he wishes to use.
Thank you, Mr. Speaker. I want to thank the chairman of the House Appropriations Committee and his great staff who have worked diligently for, well, all year, month after month after month. They approved 5 months ago next week all 12 appropriations bills, one after another, regular order through the House of Representatives. And there they sit over in the Senate, where the Democrats block them. What brings us here today is really important work. Brings us here today, we are taking care of significant public health care issues. We are fully funding for the next 2 years community health centers. Now, I've heard from my colleagues about the things that aren't in this bill they wish they were, and so that's why they're going to vote no. Or some other thing that's not even before us, and that's why they're going to vote no. But let's talk about what's actually before us. What's before us is take care of our men and women in uniform and their needs, especially when they're in harm's way, and fund really, really important public health programs that used to always be bipartisan. And let's talk about those. The Valley Family Health Care in Ontario, Winding Waters Health Center up in Wallowa County. I've visited both of these recently. They're on the front lines of healthcare prevention. They're on the front lines of saving lives and helping children and adults. Or La Clinica down in Medford, Ashland area. In fact, in my district, we have 12 federally qualified health centers, 63 delivery sites that give care for 240,000 Oregonians. 24 million nationwide are served by this. On November 3rd, this House had the opportunity to fully fund those community health centers for 2 years and take care of children's health insurance and a lot of other of these programs. And it was a separate bill brought to the House floor. And a handful of Democrats broke with their party and voted with us, but unfortunately when it got to the Senate, they couldn't be to support it. So we had to come back on the last continuing resolution and fully fund children's health insurance program. And not sure many Democrats voted for that here, unfortunately. But here we are today, same process, same situation to fund community health centers. So we're going to do that. Your choice when you vote, yes or no. Do you want the community health centers funded or not? Do you want to shut the government or not? Do you want to take care of our military or not? Then there's the disproportionate share hospitals. So what are those? Those are the hospitals in our districts and states that take care disproportionately of more poorer people than other hospitals. And under the Affordable Care Act, or Obamacare, however you want to describe it, there was prescribed in law automatic cuts to these hospitals that take care of the poorest of the poor in our communities. Those cuts totaled $2 billion. And in this legislation, as in the legislation we brought from the Energy and Commerce Committee on November 3rd, we turn off those cuts. Say, don't do that to our DSH hospitals. So if you're at St. Alphonsus in Ontario, that in Oregon is the most affected hospital, I'm told. And they will lose money and have to decide how they cope with that. We solved that here for 2 years, $6.8 million in my state. And then we extend the special diabetes programs. For heaven's sakes, we should be able to come together in this chamber and in this Congress to take care of people with diabetes. My grandfather lost both legs due to diabetes. They were amputated. I have other relatives that have dealt with diabetes and still do to this day, and good friends whose kids do. So for our Native Americans and for others, we have 2 separate programs, and we fully fund them. We tie them together. That's done in this legislation. 50,000 people in my district have diabetes. My hunch is all of our districts are not dissimilar from that. We take care of those people in this legislation. And then we take care of therapy caps. Since 1997, when this law was put in place, people who needed physical therapy, my colleague from Tennessee talked about it, stroke victims, seniors who need therapy, rather than the physical therapist, the speech therapist saying, here's the program you need to get well, get on your feet, recover from whatever it is that afflicts you, the government put an arbitrary cap in and that was it. You're done, whether you were done or not. And everybody is different in terms of its recovery. We repeal the therapy caps in here. And by the way, we've heard about all these things that now won't get funded because a part of the funding for this comes out of the Public Prevention Fund. $2.85 billion is not insignificant. It's true. But we're applying that money to health prevention, community health centers. as we did before for Children's Health Insurance Program. We're providing it for diabetes help. We're removing the physical therapy caps so people can get well. That seems to me to be pretty good use of the prevention fund. And oh, by the way, during the same period we're spending 2.85 out of that, there will still remain $12 billion. $12 billion are left. And the talented folks at the Appropriations Committee will decide how that money's spent on vaccines and on all these other issues, all these things we care about. There's still $12 billion left in here. So we're using discretionary funds that were set aside for health care and preventive care for that very purpose here. And then we heard about some Medicaid cuts. Well, let me tell you what those are. We said if you're a big lottery winner, maybe now that you've won a big prize, you shouldn't be on government-funded Medicaid because, by the way, you won $1 bazillion. So we're taking lottery winners and say you got to treat that big windfall when you calculate whether that person's poor or not anymore. So that's in here. And then we said on third-party liability that if insurers actually are responsible for the cost, insurers should pay the cost rather than the taxpayers. So we make a little reform here that puts the insurers first to pay rather than the taxpayers. So, Mr. Chairman, thank you very much. You've done marvelous work here.